Benign prostatic hyperplasia, or BPH, most of us know it as an enlarged prostate. It's a non-cancerous condition that affects men primarily as they age. That prostate gland located below the bladder grows larger, can squeeze the urethra, the tube that carries the urine from the bladder. But how it's being treated just took a huge step forward for patients. Dr. Navneet Mander from Trinity Health is joining us this morning with some groundbreaking treatment options and more info. Good morning, doctor.
Good morning.
Thanks for
having me.
I'm so glad you're here. This is something that men of a certain age, know about. Talk about some of the symptoms. How would someone know that this may be happening to them?
Sure. So, as you described, that enlarged prostate can really constrict the urethra. So I like to kind of divide the symptoms into two separate categories. You have the obstructive symptoms. Those are the actual difficulty getting it out. So you may have to strain to urinate. You may have to push a little harder. You may have a little stop and go. You're sitting at a urinal and you may have 2 or 3 young bucks go by you and you're still going. The other types of symptoms are the irritative symptoms. These are the kind of sometimes more bothersome. You have frequency, you're going often, you have urgency, you have to run to the bathroom. You have waking up at night to urinate. So, this bothers you, this bothers your partner. They're having to wake up, you're having to wake up. It can progress to the point where you can no longer empty your bladder or even have a little bit of leakage.
That's something that nobody wants, right? Obviously, these are things that can be avoided. And in the past, there's been therapy. Maybe talk a little bit about what it's been and what this aquablation therapy is about.
Sure. So, in general, there's an algorithm for treatment. You start with the conservative lifestyle measures, medications. Eventually, you may progress beyond the ability for medications to treat. So at that point, you start to talk about surgery. And there's about 10 different types of surgery. I'm not going to go into all the detail.
Right.
But you have kind of the minimally invasive and the more invasive treatments. Minimally invasive does well to kind of slightly improve your symptoms, but minimizes sexual side effects. The more invasive treatments do a very good job of opening up that channel so that you can urinate better, but the side effects are a little higher. You have a more risk for especially sexual side effects, possibly some incontinence or leakage after the surgery. Aquablation is the best of both worlds. You're maximizing the channel while still avoiding the side effects and the collateral damage that can occur.
So it sounds like it's a winner. It's a win-win. But what is it? Aquablation. I mean, just that word in and of itself.
Yeah. So it's one of the newest treatment options we have, newest surgical treatment options we have available. It utilizes both imaging, ultrasound, you can see in the bottom right of the screen there,
okay.
And direct visualization with a camera where I am actually looking at the inside of the prostate. With both of those, those modalities, we're able to actually look at the borders of the prostate, map the areas where we do not want to treat, so those important areas for erections, orgasm, ejaculation, and control of urine, and tell the robot not to treat those areas, minimize the damage, while still maximizing the channel. You can see here in the video, the robot then performs its job. It uses a high-pressure cold water jet to destroy that tissue. You're left with a wide open channel with minimal sexual side effects.
Wow. Which describes the word aquablation. You're using cold water to basically get rid of that tissue.
Right.
Yeah, to open that up. This has got to make recovery better too, right? I mean, this is pretty minimally invasive.
Right. Well, without the heat, you're going to have less of that inflammation that can occur. The short-term recovery process is about 2 to 3 weeks. By the time patients are seeing me back after 4 to 6 weeks, usually very happy.
Yeah, like nothing ever happened, right? Yeah. Except life's got a lot better.
Yes,
much None of those issues are happening. Doctor, this is amazing technology. Is this everywhere, this aquablation? I'm just now hearing of it.
Yeah, it's a newer technology. I'm proud of our of Grand Rapids, Trinity Health Grand Rapids. We were able to have the first one in Western Michigan and still the most robust team to perform that aquablation here on the west side and northern Michigan. We currently have 2 locations in Grand Rapids, and we are here to offer it for you.
Open for business.
Open for business.
Absolutely, yep. Doctor. And the latest technology waiting right here at Trinity Health, aquablation. If you think that is something for you, or maybe you're in this journey right now and hadn't heard about this until today, maybe contact trinityhealthmichigan.org/aquablation to learn more. Thank you for the time again, Doctor.
Thank you very much for having me.
You bet. We'll be right back.